Yes, it's something that often people don't think about when they're getting ready to go back to school. There is research from the American Occupational Therapy Association that has shown that as many as 2,000 students per year present to the emergency rooms and doctor's offices around the U.S. with backpack-related injuries. So, when you go to pick out a backpack, make sure it's a backpack with 2 well-padded shoulder straps. A lot of the times kids want these backpacks with just 1 strap, but this is what we want to shy away from. Once you have the backpack, you want to make sure that it's the correct size for the student that you're fitting it with. Obviously for Jordan, if we have this backpack, if you can turn around, sweetie, just turn to the side, good. You want the backpack to fit just below the shoulder level, about 2 inches, and then rest right on her waistline, or slightly above or slightly below. But you don't want any more than 3 to 4 inches below the waistline. So this bag would be way too big for Jordan. But if you have Miranda, the backpack would fit Miranda perfectly. I'm going to put your arms in. As it sits just at her shoulders and just below her waist. So then when you look for a backpack for Jordan, we want one that's smaller. This backpack is much shorter, so it will fit her midsection better. And that will assure she won't have any back pain either. You can see Courtney's backpack right now is fitting low and loose hung. You see it a lot with kids, but this is what we want to avoid, as it creates a backward pull and then creates low back problems with strain. So all we would do here with Courtney, pull the backpack up, easily tighten the straps until the backpack is snug against her back. Turn around. We'll tighten the other one just the same. And you want to make sure that both sides are tightened evenly so that one side doesn't have more strain or more pull than the other. So now that Miranda's backpack is properly fitted to her, we can take it off and begin loading the backpack. So the first rule of thumb is the backpack, when loaded, should weigh no more than 10% of the child's total body weight. So if Miranda weighs 75 pounds, her backpack loaded should be no more than 7.5 pounds. Right here in this pile of new school supplies, it weighs exactly 7 pounds. So once we load the backpack, we're going to put the largest items and the heaviest items in first, so they're closest to the child's back. All other items should be arranged somewhat neatly, and again by size, just making sure that the items aren't going to move around while the child's walking. Now, we have the backpack loaded with all of her school supplies, but she still has her flute, which would exceed the 7.5 pound limit, so we'll just have her carry this. Her backpack's on. Does it feel okay? Is it too heavy? No. Sometimes, even abiding by the 10% weight limit, the backpack might still feel heavy for the child and still cause some discomfort. So another option is to look for a backpack then that has either a waist strap like this one, or other backpacks also have a chest strap that comes across the 2 straps to hold it on and help distribute some of that weight. So Miranda's all ready to go. So another thing we often see with students is that they carry their book bag on one shoulder, whether it's for ease or because they think it looks a little better. But what this causes is uneven pressure. It's pulling on this one shoulder where you want both shoulder straps on to distribute that weight evenly and help prevent any back problems. You see a lot of low back strains, shoulder problems, numbness and tingling down through the arms and the hands because of the shoulder impingements, problems with pain in the neck. Also, if kids wear backpacks with only one strap, or they only wear one strap at a time, that's how you get the curvatures, where it pulls on one side and not the other. Anytime a kid takes off their backpack and kind of exasperates that, you can tell that it's too heavy. If they complain about any discomfort, any pain, any numbness or tingling through the arms or the hands, any pain also or discomfort in the shoulders or the neck, and all down the back.